wearable health devices flooding into the market, the healthcare system is quite hesitant to integrate them into the treatment and ongoing monitoring of their patients. So things are starting to change. Enter Garmin, one of today's most respected wearables companies in the world. Their work to help physicians meaningfully integrate these consumer wearables into their treatments are becoming more and more pervasive. We've invited Sean McNamara here, who can join me on stage, from Garmin Health to share so much more on this exciting development. Thank you.
Thanks, Jill. Thank you, Jill, and thank you all for allowing me to come out here and speak. So my name is Sean McNamara. I manage the sales and marketing team for Garmin Health. Garmin, for those who aren't familiar, is a multinational technology company that designs, engineers, manufactures products in a variety of different industries, some of which you see up on the screen there. I would assume most people in the audience are probably most familiar with Garmin as a GPS navigation company. And that's really where Garmin's roots are. But Garmin's actually been in the wearable space for close to 15 years at this point. And obviously, a lot has changed in the past 15 years. And I'm not talking about Facebook or Bitcoin or the social media habits of our president. I'm strictly talking about the evolution in wearable tech, right? And over the past decade and beyond, we've seen pretty significant differences in not only size, form factor, functionality, as you can see from this slide here. But as the story goes at Garmin, our first wearable device was created when an engineer wanted to solve what he thought was a pretty simple problem. He wanted to get accurate distance and pace on a run, scoured the market looking for a product that would allow him to do this, really couldn't find any product that allowed him to do it. So he thought to himself, Garmin's a leader in GPS technology. Why don't I take a GPS device designed for a car and apply that to fitness? So he took a GPS unit, the one you see over there, tied it to his wrist, took it out on a run, and really from there, wearables at Garmin were born. And in the wearable space, Garmin's mostly known for high-end watches that are designed for athletes, right? Running, swimming, cycling. And while still continuing to lead in that market, consumer interest, investment has really exploded, right, over the past 5 to 6 years, and in more basic wearables and activity tracking, and that's led Garmin to pretty aggressively pursue that space as well. As that market, the wellness-heavy market from a wearable side, begins to mature a little bit, another massive opportunity is opened up for healthcare, for applications in healthcare for wearables. And that leads us to Garmin Health. So Garmin Health was formed as a way to capitalize on enterprise opportunities with wearables and also drive innovation with our product roadmap to provide more utility in the healthcare space. And as mentioned earlier, right, wellness, fitness, those were really the first markets to embrace wearables as we know them today, from activity tracking to weight loss to personalized coaching. You know, these fitness-centric applications, we're using the embedded sensing tech in wearables to deliver new data streams that allowed for additional value to the consumers. And as corporations started to look for new ways to curb healthcare costs, wellness platforms have gained popularity over the last decade or so in the promise of delivering a healthier, more productive, and obviously cheaper workforce. And I think the jury's kind of still out on the efficacy of some of those claims. And it hasn't really slowed the prevalence of those programs with employers. But now payers and providers are getting into the mix, and I think they've been under more financial pressure over the last few years, and they really started to evaluate solutions to assist with that problem. And so one market we've seen a ton of growth in over the past probably 24 months is healthcare. And the US healthcare market is in a very unique position at the moment as financial incentives for value-based care and really the ubiquity of chronic conditions have pushed care providers to really explore new methods to better engage their population and patients in their own care. And behavior and lifestyle choices like poor diet, smoking, excessive alcohol intake, lack of physical activity, and chronic stress are really the key contributors in the development and the progression of preventable chronic disease. And with chronic disease accounting for over 80% of United States healthcare costs, it's kind of hard to avoid that inevitable question of how do we address this growing healthcare crisis? And a key factor in addressing the spread of preventable chronic diseases is data. And wearables play a pretty crucial role in the accumulation of that data that provides a more holistic picture of really the interconnected endpoints that make up a person's health and wellness. And wearables provide a continuous, objective, non-invasive, and in comparison to alternative options, relatively inexpensive solution for both payers and providers to gather actionable data on the populations that they serve. So, as mentioned earlier, right, health systems in the US shifting from fee-for-service towards value-based care and investing in inexpensive solutions that remotely monitor their population is becoming increasingly important. So, remotely monitoring patients will become easier with automated data delivery mechanisms that providing access to activity, to sleep, to heart rate, to stress, and beyond. In the event that a patient's values fall outside parameters that have been specified by that provider, caregivers can be alerted to reach out to patients to ensure communication during or before or after a high acuity event. There's also been tremendous innovation on the software side, right? Especially as it relates to artificial intelligence. Everyone take a drink. It's been 5 minutes since I said AI. And that really, truly has allowed for the detection and diagnosis of chronic disease with high levels of accuracy on a scalable level. And we've really just begun to scratch the surface there of what's possible with the existing sensor data streams and wearables today, let alone more clinically significant endpoints that you're going to see probably in 2018 and beyond from a variety of wearables manufacturers. It's really going to allow for a wider variety of disease identification with that increased accuracy. And so, with the rise of healthcare costs and premiums in the US, insurers and employers, they've shifted that first dollar cost burden onto the members. And high deductible health plans, self-service health tools, that's really placed the onus on the member to take a more proactive role in their health and wellness. And in addition to changing health plans and the structure of health plans, insurers have begun to invest in wearable tech as a way to gather impartial data on their members and really incentivize them to achieve specific health goals in hopes of improving health, reducing claims cost, and better stratifying the risk within their population. And so leveraging wearable devices in market today, it's a great way for payers to drive behavior change without having to sacrifice stickiness, ease of use, and interest from their consumer base. And a great example of this would be the United Healthcare Motion program, right? That's live and running today, and it's been showcased on the floor earlier. They're using consumer wearable devices from Garmin, Fitbit, Samsung, and others, incorporating the data from them, financially incentivizing their membership to get engaged in their health, without sacrificing the utility in the consumer space, which is refreshing to see a large payer make such a significant investment there while still balancing that value. So another piece of this is the government side, right? And that has certainly evolved over the last 12 to 18 months quite a bit. FDA specifically has really helped to open wearable usage in healthcare. So the passing of the 21st Century Cures Act, innovation for medical products, both hardware and software, are given a much needed refresh that updates the speed of development and allows new tech to come to market much, much quicker than it has in the past. We've also seen changes from other federal agencies, right? CMS has issued new guidelines around allowing providers to be compensated for remote monitoring, really further incentivizing the advancement of digital health. So the utility of wearables in healthcare, and I know I'm running low on time, but it continues to increase, right, as applications and use cases for the data generated expands. However, I think a large part of that value of wearables in healthcare is utility in the consumer space, right, which seems somewhat counterintuitive, but people want to wear these devices because they're fun. They engage us in our health and our friends' health. We can engage in social experiences through that data. They provide value to us outside of being a doctor on the wrist. And as Garmin and other wearables continue to push into the healthcare space, we really need to be mindful of the fact that there's a balance there. We need to straddle that line to still deliver that consumer utility. So for us and for other wearables, I think the goal is to remove as much user friction as possible, continue to deliver on the consumer utility of these devices, but also push innovation for medically significant endpoints that enable a wide variety of applications to layer in analytics, intelligence, and clinical expertise to really make a real impact in the consumers that wear these devices. I know I'm being played off stage here. No. Thank you guys for the time today. This is my contact information. If you want to reach out, ask questions, thoughts, feel free to do so. I'll also be around after the show as well.